Hey, AxeView here. Welcome back to another episode of Axe Ed. Today we're going to discuss healthcare savings accounts, a quirky feature of the healthcare system that will allow you to save money over time, but comes with great risks and responsibilities. So let's dig in. Whether you get your health insurance through an employer, the private market, or Obamacare exchanges, you may have seen certain health insurance plans with what's called a healthcare savings account option. This can allow you to put money away outside of your premium and help save over time, but it comes with certain risks. A healthcare savings account, or HSA, may be a feature of health insurance plans defined by the IRS as high deductible health insurance plans. These plans have higher deductibles than other plans you might see, but they come with added benefits and added risks. The first feature of an HSA plan you may notice is that it has a lower premium than many other insurance plans, but a much higher deductible, sometimes twice as much as the other insurance plans on the market. This means that month to month or paycheck to paycheck, you might be saving money on your premium, but you'll have to cover more of your health insurance costs in a year than if you would on those other insurance plans before you meet that deductible. To define terms, just for the sake of clarity, a premium is the price you must pay for your insurance plan every single paycheck or every month just to have that insurance. A deductible is the limit set of all the amount of money that you must spend before insurance kicks in whatsoever on medical expenses. That's a deductible. Above that is your out-of-pocket maximum. So beyond what you spend in your deductible, what is the amount that you can spend in a single year before insurance will cover 100% of all your expenses? Between your deductible and your out-of-pocket maximum, there's usually some amount of co-insurance at play. So you might pay 20% of every medical expense and your insurance company would pay 80%. In the past, you may have chosen a high deductible insurance plan with an HSA option simply because it had the lowest premium on the market. Some people say that that's the catastrophic option. You're betting that you won't get into an accident or a high-cost medical expense because your deductible is higher and sometimes your out-of-pocket maximum is higher. Now, if you don't have money to put aside into an HSA or the money to cover your out-of-pocket maximum in a year or even your deductible, then I would recommend choosing a higher premium plan if you can afford it. That's to say, you don't want to be stuck with a giant medical expense if disaster does strike. However, if you do have some indispensable income, then I would strongly recommend an HSA for you. That way you can put away some more money every single month into that HSA. The HSA is especially critical because it is a triple tax-free account, the only tax-free account that is not taxed going in, not taxed coming out, and not taxed on any investments gained in the account whatsoever by the IRS at any time. It's the only account like that in the United States. So where does this HSA money go? Well, at any time you can deduct from the HSA account and use it on medical expenses tax-free. It's taken out from your taxable income, so you're not taxed on it whatsoever. And then after 65, you can use it for any expenses at all. Before then, it must be on medical expenses. Now, the first year of an HSA might be difficult because you don't have any savings in there. But over time, you can start to pile up your savings and more than pay for your deductible and your out-of-pocket maximum. And then once you're 65, that can turn into a retirement account where you can take it out. It's never been taxed going in or out, unlike a 401k, which is taxed either going in or out. And that's just free, tax-free money that you've saved up over time. Another added benefit is that you are allowed to invest your HSA money that you put in there. I would recommend saving in cash enough to cover either your deductible or your out-of-pocket maximum, and then using any additional savings in that account to invest and grow on the stock market so that you can really turn it into a true retirement account, growing your money over time and never getting taxed on the gains, what you put in or what you get out. Now, there are certain annual limits to how much money you can put in, and always be assured that you have enough cash to cover that higher deductible and possibly higher out-of-pocket maximum in a year. So there are certain very serious risks to this, but it is a great financial tool if you have some dispensable income on the side that you can put away for retirement or medical expenses. And you can always take out the money sooner or for a non-medical expense, but you're going to get taxed a penalty by the IRS if you do so. I hope this clears up some things about an HSA and the financial ability that it can provide. But do not take it lightly. Take your time to analyze your finances and make sure it's the right tool for you. This is not just a medical insurance plan, but another financial retirement tool. Thanks for watching another episode of Axe Ed. This has been AxeView.